I'm going to mute and get started here. Thank you for joining today's conversation, Confronting Sickle Cell Disease, an open discussion on barriers to care. As part of our webinar series, NABJ is partnering with Global Blood Therapeutics, or GBT. This evening's session is to provide a deeper understanding of sickle cell disease and its inequities through the perspectives of our experts and panelists. I'm going to introduce them first by name to you. Dr. Kim Smith Whitley, Dr. Wanda Whitney, like Gurney. Dr. Kim Smith Whitley is from GBT. Dr. Whitney Gurney is from the Michigan chapter of Sickle Cell Disease America, Association of America, and Lena Harvey, who is a warrior and living and thriving from what I can see with sickle cell. I'm going to give you an opportunity to introduce yourselves to this group. Many people here already know me as NABJ VP of Broadcast, but this is an opportunity for them to get to know you. We're going to start first with Dr. Kim Smith Whitley of GBT.
Good evening. Hi, I'm a pediatric hematologist and Executive Vice President, Head of Research and Development at Global Blood Therapeutics. Thank you to NABJ for hosting and for all of you attending this evening's session. After 30 years of dedicating myself to the care of children living with sickle cell disease, I transitioned to Global Blood Therapeutics in order to have a broader impact on the sickle cell community, because GBT was actually founded in 2011 to focus on sickle cell disease, and they're dedicated to developing and delivering medications for individuals with sickle cell. I'm really grateful to the partnership with NABJ to advance awareness of sickle cell disease, and we're looking forward to a great conversation this evening.
Dr. Wanda Whitney Gurney, please introduce yourself, please. You're on mute. That's okay.
Okay, so it's Wanda Whitney.
And
I'm a general pediatrician by training. I spent 30 years in the Comprehensive Sickle Cell Clinic at Children's Hospital of Michigan doing outpatient care for children with sickle cell disease and their families. And now I am the CEO and medical director of the Sickle Cell Disease Association of America, Michigan chapter. And I was thrilled to get the invitation to be a part of this panel. One of the things that I always say is that people don't know much about sickle cell disease, and what they do know is frequently wrong. So there are a lot of myths that need to be dispelled. So hopefully we'll do some of that this evening.
Thank you. And Lena Harvey, please introduce yourself.
Hello, everyone. My name is Lena Harvey. Can you guys hear me okay? Great. I am a sickle cell warrior. I am a sickle cell patient advocate. I have actually been just blossoming over the past year or so on my sickle cell journey. I am as healthy as I have ever been. And that, as you can imagine, it sounds like a lot, because it is a lot. It is a lot. I have been very much blessed by so many people who have made it possible for me to be here, and to be here in a healthy manner, both in mind, body, and spirit. And I am just so pleased to be here this evening with Dr. Kim Smith Whitley and Dr. Wanda Whitney. These women to me are everything. They are exemplary of what it takes to just speak up and say, you know what, someone needs to do something about this. So I guess that's me. And that is a very powerful notion. And I am just very, very humbled and honored to be here with everyone who's on tonight, every person. Thank you so much. I am ready for some great discussions, some great questions. So let's just have at it. Let's have at it.
All right, great. So this is going to be an interactive engagement. You're going to see just a few times tonight an opportunity for the audience to join in. We also want to remind you that if you have questions along the way, we're going to get to those later, but please jump into the question and answer section there drop your questions so that we can grab those. But first of all, we want to jump right into our poll question for the day. Our question to you, our first of 3 poll questions popping up on the screen. Please answer those. What is your current knowledge of sickle cell disease? You see that on the screen. I'm going to give you just a few moments to chime in. I'm really grateful for everybody taking time out on a Wednesday night to be with us. It means a lot, and there's a lot to learn from what we have to share here tonight. So our poll question is up, looking for you to jump in and answer. And as folks jump in and answer, I'm going to put my answer in here real quick. Looks like I have an opportunity to do so. Maybe not. We want to get to a video that kind of explains a little bit more about sickle cell for those of you who need to know a little bit more and maybe looking to learn a little bit to what you already know. Please, if you can, Dr. Smith Whitley, please introduce the video that we're about to see.
So Ken, I think that you stated it well. And the reason that the poll question is so appropriate is that one of the issues with sickle cell disease is that it's often been a condition and a community that's been neglected. And because of that, there's not a great deal of awareness about sickle cell disease and what it is. And so I hope after watching this short video, people will get more information, accurate information about sickle cell disease.
Hey there, I'm here to tell you about sickle cell disease, an illness that affects over 100,000 people right here in the United States and millions more around the world. The first thing you need to know is that you can't catch sickle cell. It's caused by a genetic change that is passed down from your parents. If a mom and dad both have that change gene, then their child has a chance of being born with sickle cell disease. Now, let's talk about what sickle cell can do to your body. These are red blood cells. More specifically, these are healthy red blood cells. These little guys are what carry oxygen all around your body to places that need it, like your heart, your brain, and your lungs. See how round these red blood cells are? That shape and the fact that they're super flexible allows them to move through the body without any holdups. That's good. People who live with sickle cell disease do have healthy round red blood cells, but they also have cells that look like this, a little different and not as round. See that? It kind of looks like a banana, or what they call sickle shape. So, the big question is, why do some red blood cells sickle? It starts with something called hemoglobin. Hemoglobin is the part of the red blood cell that carries oxygen. People with sickle cell have a type of hemoglobin that doesn't carry oxygen as well. After sickled hemoglobin releases oxygen, it clumps together in a stiff rod inside the red blood cell. This causes the red blood cell to become sickled, or banana-shaped. That whole process is called polymerization and is what changes the shape of the red blood cell. Sickled red blood cells are very fragile. This causes them to break down more easily than healthy red blood cells. Picture a jelly donut exploding. Everything is released from the red blood cell, and the entire thing breaks apart. This is called hemolysis. When those sickled red blood cells break down, one of the things that is released is a substance called bilirubin. Too much bilirubin can cause the eyes and skin to turn yellow, which is called jaundice. Also, because the sickled cells break down, there are less and less red blood cells in the body to carry oxygen. When there are too few red blood cells carrying oxygen, it can lead to something called anemia, which can make people weak and tired. Also, those sickled cells are stiff and sticky and don't move freely. They can pile up and block blood flow inside your blood vessels. It's like a traffic jam and can keep the healthy red blood cells carrying oxygen from getting where they need to go. When those banana-shaped red blood cells get stuck in the tiny blood vessels, it can also cause a lot of pain. in the joints and bones, in the chest and stomach, it's called a pain crisis, or an even bigger word, vaso-occlusion. VOCs for short. A pain crisis can last a few hours. It can last days. And it can be so bad that a person with sickle cell may even need to go to the hospital. All of this, the red blood cells bursting, the low number of healthy cells, and the traffic jams in the blood vessels means that less oxygen is delivered to the body, and that can do a lot of damage to important parts of the body, like the bones, organs, and tissues. They all need oxygen to do their jobs and keep you feeling your best. So now you know what sickle cell is and what happens in the body when cells sickle. Sickling happens every day. The traffic jams, the lack of oxygen, they always cause damage even when there isn't any pain. That's why people living with sickle cell are warriors. Some of the strongest, most courageous people walking on planet Earth today. They want to live their best lives, and I'm here to cheer them on.
Okay, that video was amazing. And I saw some of your chats. I agree. When I first saw that last week, I thought, wow, this really helps a ton. I'm being told now by NABJ that we have an opportunity to take a look at our poll results for just 1 second before we move forward. We take a look, and it shows a lot of people and a lot of people believe they know a lot and some about this. I would gather to say we're going to learn a whole lot more just listening to this panel as we go. If you have any questions, again, please put those in our Q&A box and we will get to them. First of all, I want to give an opportunity for Dr. Whitney Gurney. You've been at this a very long time, and this really is a family affair. I want you to talk to us a little bit about why you have committed your career in your life to sickle cell disease. And I know that Dr. Whitney Gurney was having a little bit of problems. She's joining us from away. She's at a hotel right now, and we may have lost her, but that's okay because we have a lot of other individuals to learn from. Lena Harvey, thank you so much for joining. You had to do some maneuvers to get around weather tonight to be here for us. Thank you for doing that, literally running to a friend's house to make sure that you can help inform us a little bit more about sickle cell. I want you to talk to us a little bit about your personal experience as a warrior. What stands out to you as those important challenges, those challenges that have really created barriers?
Oh my gosh, Ken, thank you so much for that. First of all, I just want to say again, I'm very happy to be here. The challenges for sickle cell warriors today are almost endless, you guys. And I hate to start it out that way, but I want to give you a reason why. One is because, in my opinion, a lot of the issues that we face are like dominoes. If you can fix one at the root, if you can fix one issue at the root, it can change a lot. It can change a lot of different issues and other types of symptoms and, issues that happen because of just one thing. For me, I am a wife, a mother. I am a 37-year-old sickle cell warrior, which to me sounds amazing because when I was growing up, it was very much like, oh boy, like you might want to hurry up. You don't have that much time. You go to the doctor and it's just that feeling, even if the words are not said in that way, in that manner. But for myself, I always felt a bit rushed, like I need to get this train moving if I want to squeeze as much as I can out of life. And that mindset changes you. You're not just a person anymore. Now you're a patient. Now you're someone that has to put your actual physical care and safety number one above everything else. And I don't think that most people understand how that is very different. That's a different way of living. Most people just get up and eat breakfast and go to work, and, they work and then they come home and, but for a warrior, every moment is, do I make the right decision? How can I, make sure I'm not going to be in pain again? Or am I in pain right now? Because the answer is usually yes. So the barriers are people not understanding sickle cell, people not understanding how, and the mindset of a patient is different from the mindset of a regular person, someone that just simply doesn't have to spend that much time, thinking about their health because they don't carry a chronic illness. Like it's completely different ways of thinking. And so every day when you live as a warrior, every moment is about the preservation of yourself. Every single moment.
That's powerful. That is powerful. I talked to a couple of NABJ members who are living with sickle cell, and the stories that they share were just remarkable. I think we may now have Dr. Whitney on the phone joining us now. Is that correct?
Yes. I am on the phone.
Good.
I didn't know whether you wanted me to try to join the meeting again or just do everything by the phone. What works better?
I will miss your face and love your voice. We'll take that tonight. How about that?
Okay,
So
that sounds good.
Great. I want to back up because I had a question addressed to you a little bit earlier before I realized that you dropped off, and I want to make sure that we get to this because, again, you followed family footsteps into this. Tell us why sickle cell disease has become such a passion for you and a driving force in your career and your life.
Well, Ken, thank you so much for that question. Both of my parents were shakers and movers. My mom was involved in Planned Parenthood, and my father, of course, was involved in sickle cell disease. Dr. Charles Whitney, he actually was one of the founders of the National Association for Sickle Cell Disease, and he thought that organization was important because there was information that we had about sickle cell disease that we weren't putting to good use. My dad also started the Comprehensive Sickle Cell Clinic at Children's Hospital, where I spent 30 years, and he started the community-based organization, the Sickle Cell Disease Association of America Michigan chapter, where I am now the CEO and medical director. And our primary mission is to maximize the quality of life of individuals living with sickle cell disease. So, Ken, I feel like I was basically raised in the sickle cell community. I grew up in the sickle cell community. And it kind of, I really, people always said, are you going to be a doctor like your dad? No, and then one day it felt like I woke up at Howard University College of Medicine, and the next thing I was a doctor. But, I think, carrying on my father's legacy has been really important to me. And in a way, trying to establish my own legacy. And, I think that if I talk about how did I get into sickle cell in the first place, yeah, that was my family connection. But man, when I think about why I stay in the sickle cell community, it just really has to do with inspirational people like Kim Smith Whitley, Dr. Frempong, who we recently lost, and even more importantly, people like Lena Harvey, who I'm watching thrive, and I'm seeing their resilience. I did a year of a hematology fellowship at Children's Hospital. I went to 9 funerals in a year, and I spoke at 3 of them. And I decided I didn't want to, I wasn't good at detached concern. Well, my last rotation was in the Comprehensive Sickle Cell Clinic that my father had started, and I was like, oh, I'm home. This is where I want to be. And so I spent that time there. But my concern now is I'm starting to go to funerals again. And so what keeps me going is trying to help individuals living with sickle cell disease not just live longer and longer, but live better and better.
And while we have the opportunity to hear from you and we have you on, I want to ask you another question right back to back. Talk to us, if you can, about what you've seen in Detroit, Michigan. What's been done there to identify and address some of the barriers for sickle cell disease in the community?
Okay, good. I really feel like the stars are aligning with respect to sickle cell disease. This is such an exciting time. in the sickle cell movement, so many good things are happening. And a lot of those good things are happening right in Michigan and particularly in Detroit. We have a wonderful partnership with the Michigan Department of Health and Human Services, and we serve as the coordinating center for newborn screening for blood diseases. So our organization is able to wrap our arms around every child born with sickle cell disease in the state of Michigan since 1987. Now, you know, if anything good came from the pandemic, it has to do with that shining the light on healthcare disparity. And our governor, Gretchen Whitmer, kind of paid attention to that. And I actually gave a presentation to her task force to address healthcare disparity. And that, in partnership with the Michigan Department of Health and Human Services, led her to put money in the budget for what she called a proposal for change. And that allowed our special supplemental insurance to cover patients with sickle cell disease throughout the lifespan, where it previously coverage ended at age 21. So now, mind you, coverage went throughout the lifespan for people with hemophilia and cystic fibrosis, but it stopped at 21 for sickle cell. So there you have some healthcare disparity, right? And so when that happened, that allowed us to be able to support our adult patients better because we could bill more for their care. But in addition to that, there was the Michigan Enhancement Grant, which was specifically to help Detroit establish a center of excellence for adults living with sickle cell disease. So that is really what we're working hard on now. In fact, I am at the American Society of Hematology's workshop on how to actually do that, because what we really want is to have a true medical home for adults living with sickle cell disease, where they can get specialized sickle cell care, they can get their routine health care, they can have mental health support and social work support and alternative strategies to managing pain, so that what we can do is to start managing wellness rather than just treating complications.
Great. And I want to talk a little bit also about that, because when I talk to some NABJ members and some other people who are close to me about living with sickle cell, one of the things they talk to me is about how this health issue and race went hand in hand, and it played a role in some of the inequities. And I want to go with Lena and you to both kind of talk to us a little bit about how race has kind of created some of those barriers that make it a little bit more difficult for people of color to get the assistance that they need. And Lena, if you want to start.
Lena, you want to start?
Yes.
Sure, thank you. So I just, I have sat and, in many a conference where I have, looked up and on as Dr. Wanda Whitney has just poured knowledge on my brain, right? So I'm just, having one of those moments, with you guys as well. But as to the questions, I feel that one of the main issues is it's always the ugliness is the answer, which is why we're always asking each other and questioning, like, where is this coming from? Why is it this way? The disparities are there, and they have been. COVID unearthed the ugliness of how we treat one another, you guys. And in the medical field, when you walk in as a patient, it doesn't matter if you're a chronic illness warrior or not. If you're just someone that happened to have an unlucky day and you go in, it is scary. It is the scariest thing in the world, because you don't know what is going to happen next. And you're not sure if you're going to be able to handle it as a human being, whatever the solution is, to your issue that is the most important thing to you, because it's your body and your life. And so when something happens and you go into, crisis, and you are at your most vulnerable state possible, that is the worst time to then be rebuffed because of something as trivial as your bank account status or lack thereof, or your skin tone, or your gender, or just whatever, right?
Yeah.
Like, it's adding insult to injury for an unnecessary it's completely unnecessary. There's no reason why I should have to go through so many steps ahead of time in preparation for my emergency in order to make sure that I get the care that I already just deserve as a human. But I have to do those things, right? I call ahead, I do all the stuff, right? I do the things because it is a scary situation when your life is in danger and you must trust those around you, whether you know them or not. That is a feeling that does not go away as you age. The only thing that happens is that we learn how to empower ourselves as patients and advocate for ourselves and our children that are suffering unnecessarily. So as a woman, as a mother, as a patient, as a sickle cell warrior, I learned early on that I was going to have to speak up and loud and often if I wanted to survive, because the people and the energies that you come into contact with are not always in agreement with that plan. They don't, that's just how the world is. And so we develop a tough skin in ways that other people have no idea. And honestly, you guys, it might sound like a lot coming from me, but see, I'm a woman who was raised a certain way. And so when I present myself for treatment and care, it often goes wonderful, right? It goes great, you know? Guys, like, that's not the norm.
Right.
That's not the norm. That's not the norm. It goes great and wonderful because I look like this. Even when I'm in crisis, you know, it's something about myself that puts people at ease, like, oh, I should be taking care of her. I want to make her feel better. We're low on compassion these days, you guys, all right? We all know this. We know this. We know, we see the news. We know what's going on right now. Right now. So not all of those things make sickle cell warriors' lives that much harder and more difficult because we're taking one look at and then we're deemed. I don't have time for that today.
Evaluated on site. I want to do one thing because these poll questions are important and we're talking to a group of journalists. So I want to get into poll question number 2, and that's going to pop up on your screen. Answer as you see that there. Poll question number 2, do you believe media should have a role in educating the public about sickle cell disease? Do you believe media should have a role in educating the public about sickle cell disease? I want to thank Paisley out of Atlanta for going into the chat, dropping a question in. Greatly appreciate that. We're going to get into that a little bit later. If you have a question, please make sure you go into the Q&A, excuse me, not chat, but Q&A, and drop your question there. And we have this one poll question so we can learn from you, and we'll get results from that in just a moment. But I want to go on to our next question. What role do each of you think the media can play in bringing about public education and awareness to sickle cell? I want to start with Lena and then Lena Harvey, and then after that, go to Dr. Smith Whitley.
So as far as the media is concerned, and quite personally, this is, I'm not new necessarily to the media. I definitely have done plenty of, like, you know, local news spots, things like that. I've been on several little, you know, several sections, several facets of my own little, you know, media bubble when it comes to sickle cell. But when we're talking about projecting a certain or highlighting a certain issue that is sickle cell or sickle cell warriors, especially across the country, that becomes a very, you know, difficult, that becomes a more, that becomes a heavier issue, a much heavier issue, one that needs gloves, right? Because what we don't want to do is, first of all, disrespect anyone. We don't want to disrespect or make anyone feel isolated or marginalized, because that is who we are. For one, that the sickle cell warriors are, that's our neighborhood. So I want every media outlet to always have respect for sickle cell warriors, first of all, just off rip, because we have lived lives that are unimaginable. You know, the amount of pain has been, it's unimaginable for the average person. And that is something that I have been able to experience. Both on both ends, the end where I did not know that my little body could hold this amount of pain. And then I've been on the side more recently where, you know, I've been a lot healthier. I've had a lot less pain, no crises. And now I'm understanding, oh boy, this is drastically different. What I was used to, that type of pain, that is not something that anyone should take lightly, should try to gloss or skirt over, because it changes you as a person. So we have to keep the integrity and make sure that the patients are respected and that everyone understands what angle they're coming from. It's one of constant high levels of pain.
Dr. Smith Whitley, if you can chime in there, the question about media and the role that media plays in awareness of sickle cell disease. And we see a lot more now discussion about health, but not every topic of importance is hit. Talk to me a little about that from your perspective, if you don't mind.
Yeah, thank you. Because I think this is really important to draw attention to. When you think about sickle cell disease, you think about the fact that the first individual with sickle cell disease was described in 1910. It didn't have medications specific for sickle cell disease until the 1990s. And when you look at special legislation that was put in place to develop medications for individuals with rare disease here in the US, we only had 3 additional medications added. You know, so one of the things that is really important for the media to do, I think, to contribute, is to draw attention to these disparities. The disparities that have impacted the sickle cell community from years and years and years of health and social inequity. I think that we have to draw attention to the fact that despite having medications that were specific for sickle cell disease, we didn't have an infrastructure to put into place to make sure that individuals were getting high quality care. And high quality care includes respect and compassion. And so when you think about the infrastructure, it is really, I think, an issue that individuals are still having to search for this high quality care. We've been lucky in the pediatric community to really find a way to develop the resources to make sure that the access is there. But this is lost, very much so, when individuals become adults and they need adult focused care. And this is not to say anything negative about the doctors that are providing that care. This is to say that there's not enough of them to do the work that really needs to be done in a comprehensive way. I think the other piece is to draw attention to the stigma and to the individual's experience about sickle cell disease. And there really haven't been enough studies to look at what the individual is experiencing. One of the things that GBT has done recently is something called the SHAPE survey, Sickle Cell Health Awareness, Perspectives, and Experiences, and really trying to look at multiple nations, multiple perspectives from individuals living with sickle cell, their carers, and their healthcare providers, and trying to understand what the opportunities are to bring things together so that we can understand the experience of the individual, understand what the provider is seeing, and find a way for them to meet in the middle. And what is really clear is that there are healthcare providers that believe that there is one way of doing things, and that there are individuals living with sickle cell disease that have not been asked about what their perspective is and how to make sure that the healthcare team understands their perspective. So it's very important to highlight these types of studies that are bringing the individuals living with sickle cell disease experience forward, and to draw attention to what needs to be done to decrease or minimize these gaps, so that the access to high quality care, which includes being cared for by a provider who can understand the condition and your experience with your chronic illness, is really, really paramount.
So I saw Clifton drop in there. One thing I learned when I talked to, and thank you for these warriors who are jumping in to the chat and adding to this conversation. One individual that I spoke to said that when they went in for pain, that the automatic assumption was because they're Black, they were addict. And they weren't given the attention. And these are people who are professionals who came in, unfortunately, into the ER looking for emergency help. And another said that they weren't taken seriously. Is that something that you've seen on a larger scale? Clearly, Clifton has said that, and someone else other than Clifton has relayed that to me. Dr. Smith, Whitley, is that something that you've seen across the board in your research?
So I've not only seen it across the board in the research experience, we definitely see that coming across in the survey, which is going to be very important. And we're just getting little pieces of the survey that's going to be coming out in June at a big European Hematology Association conference, and those details will come. But one of the things that happened right before the pandemic, and I don't know if you're aware of this, is that we had new health policy that was mandated because of the quote unquote opioid crisis. And that policy trapped individuals living with sickle cell disease in the middle, because it already took a situation where people of color were coming into the emergency room with pain that needed to be treated, and that there is no disease specific therapy that addresses pain. It's only supportive care, right? That we're putting a Band-Aid on for acute painful episodes. And then we're taking that and we're layering all of these new rules around the delivery of opioids on top of that. And I think it really, really brought the incredible disparities that individuals with sickle cell disease face forward, and really trying to advocate to undo some of the impact of that has been really what we're seeing in emergency rooms all over America.
I want to ask you this one question, just because the journalist in me is dying to understand this. When I heard that, it kind of shocked me, because from what I understand was that the opioid crisis didn't have a huge impact in the Black community for reasons outside of the norm. So when I hear Black people saying that they're going looking for pain medication and thought to be addict, it doesn't even sound like there's a profile that fits here. Is that an understanding? Am I off base with that, or?
I can see my other two panelists wanting to speak up on this, so I'm going to ask them to go first.
I'm gonna ask you, weigh in very briefly for me if you can, and then I want to get to our results from poll question number 2.
Yeah, I really believe that it is one of the things that makes me adamant about getting sickle cell centers of excellence across the country, so that people have access to high quality, respectful, compassionate care delivered by people who understand the issues of individuals living with sickle cell. Not only is it important to make sure that opioids are there for them, but opioids that are delivered in a timely manner, not in a way that puts somebody back into an emergency waiting room after vital signs have been taken, and waiting hours for them to get the medications that they need to relieve their pain. And this is the kind of thing that we really need to point out and really let people hear about the journey, because the stories that I'm sure we can tell are just the tip of the iceberg.
Let's get to our results on poll question number 2. This is about the media and the media role in educating. I see people strongly agree right up top. One looks like we have at least one person says disagree, another person says agree. And so those top 2 seem to weigh in heavily on that. We'll get to a couple of questions in just a moment. Thank you again for weighing in. I see Etta jumping in here off of what we just mentioned, saying, I'm still waiting for my pain med right now. It's on back order. It is on back order. That's difficult to think of. We're going to also move on to a couple of other questions because there's some key points that we want to hit today without missing out and leaving people without an understanding. Dr. Whitney, I can see your face again. Lovely to see you. I've got this next question for you. You're on mute right now. If you'll unmute, I'm going to jump on that real quick. And if you can, please talk to us about a little bit about what you've learned from what you've seen as you start to investigate what's happening in the Detroit area, in Michigan, and with sickle cell and some of those issues that you think we really need to jump into.
Well, a lot of it has a lot to do with what Dr. Smith-Whitley has already spoken about. I think this whole tip of the iceberg thing, warriors really don't want to go to the emergency room. They really don't want to be in the hospital because they get poor care when they're in the emergency room and when they're in the hospital. So they will do everything that they can do to try to stay home, and Dr. Lakia Bailey from the Sickle Cell Community Consortium says that you have to make a decision between dignity and death. If you decide to go to the emergency room, you have to swallow your pride because you're going to go there and not be treated well. And part of the problem is that, once again, we have fairly good care for children, but once they become adults, then because there's nowhere to transition them to, then they get a lot of their care in the acute setting, in the emergency room or in the inpatient setting. So one of the things we have to really focus on, and that's why I'm so fixated on having this Center of Excellence in Detroit. 75% of the patients in Michigan live in the Detroit metropolitan area, and if we have some telemedicine, maybe we can, help to provide better care to the entire state. But we really just need a place for these patients to go, as Kim mentioned, where they can get compassionate care. Another thing that happens with our patients is that when they go to the emergency room and they're requesting these high doses of narcotics, some of the emergency room doctors feel like, well, if I give you that much, then I'm going to kill you, and they don't recognize that our patients have been on these narcotics. I started kids on narcotics when they were 2 years old, and so, of course, it's not drug addiction, it's drug tolerance, right? And it would happen to anybody. If you take the same narcotic over and over again, it's going to require a bigger and bigger dose. So there's just so much education that needs to occur, to make sure that our patients are getting good care.
I'm going to jump into one of our questions here real quick and also invite our panelists. I see a lot of talk in the chat. If you have questions, please put those in the Q&A. This is from Paisley, who put this in a little bit earlier, producer out of Atlanta, talking about thriving and trying to thrive. Part of that question is directed towards Lena. How have you navigated thriving your career, lifestyle, while being a sickle cell warrior? And then there's a couple of follow-ups on that. But Lena, if you can, please.
Sure. Thank you, Ken. Thanks for the question, Paisley. First of all, I'm just blessed. I can't take credit for anything that you all see of me. The only thing I can take credit for is getting back up after my crises, making a decision to get back up, because you have to, in your mind, you have to decide ahead of time if you want to survive. But everything else has just been blessings. The second part to your question, how do I balance everything? I live my life in a way where I am the captain of Team Lena. So when I go to my doctors, I'm like, hey, y'all, team captain's here to see you. Let's have a meeting, let's talk, right? I see myself as someone who is, partially a pioneer, because I have done a lot of things in the sickle cell community that have helped to give. I do all the studies. I do anything where they're asking questions, any surveys. I'm an open book. You have to make yourself an open book when you have sickle cell sometimes, because you need the data to be on paper so that they can see, oh, wait, you actually mean that less than 10% of sickle cell patients have any type of addiction to their medications? Like, that's, guys, it's not us. It's not us, right? We know that. But the other part is, honey, I have a husband. He's my caregiver. That man has been side by side with me on Team Lena, okay, for years. You have to have people to care about your life. Sickle cell is not something that we can do alone at all. Mm-hmm. Everything you see of me is because I had a friend, a loved one, a doctor, someone believe that I was worth giving their time and energy to.
And let me ask you, because one of our questions is about how you support, how you are an effective ally to those. Does that always need to be family members? Because I know sometimes when we talk about that, we know a lot leans on that family. And we had someone mentioning being in the ER with their husband in one of our earlier chats. Talk to us about how you can be an ally without necessarily having to be within a household or within or family of that.
Yes. Sometimes, when you live and breathe a certain thing, you expect that people are just going to know the same amount of information on it. And people just don't know anything about sickle cell, you guys. I know that they're your cousin. I know that they're your best friend. I know that they're, but you guys, people do not drink in information anymore. They're on TikTok. Okay, so you have to tell your loved ones, whether you live with them or not, I need you to know the basics about sickle cell, please, because if something happens with me, I need you to feel empowered. I don't want you to feel like, well, I don't know what to do. Empowerment is the thing. Let people know that it's okay to ask questions. It really is. You might not like the answer, which is, hey, are you in pain all the time? Yeah, sorry. Yes, I'm sorry, but that's the answer. I'm so, I can't, please do never ever put your feelings above someone else's suffering. When we go to the emergency room, like Dr. Wanda, Whitney, and Gurney say, we're there because we are afraid that we're pushing it too much. We're there because we're like, I can't do this anymore. Can't do this anymore. The pain will drive you nuts, right? So when we get there, it's that time is not time to negotiate about how much suffering are we going to turn down? 10%, 15%? How much less suffering do you expect me to have? I'm a human being, right? And then also, guys, we live in America, and there's a lot of programming in America that tells you that these people deserve care, these people don't. Whatever the reason is, not true. We're all human. We all deserve care. And we are to be empowered if we're going to help ourselves and one another. We have to stitch together our own cape. There is no Superman. I'm sorry. The Supermen that we know of are right here in this room. Look at them on the screen. Mm-hmm. It's us. It's us.
So there's some people who are dropping some more chatter in chat that we definitely want to get into. Elle puts in there, we need more sickle cell medical centers that focus on care of sickle cell patients. Talk to us if you can, Dr. Whitney, Gurney, if you can, about treatment and about, why we're looking at this gap between the opportunities to actually assist people and when we knew that sickle cell was an issue.
Yeah, so I think that the main concern here, we're talking about healthcare disparity and we're talking about access to care, right? And so all of these really good things are happening in the sickle cell community, all of these clinical trials, new medications that are offering hope. But if patients don't actually have access to care, if adult patients don't have a doctor to see, then how are they going to get the medications? Because really when you talk about if care is so bad in the emergency room and in the inpatient setting, one solution to that problem is to get the patients out of the emergency room and the inpatient setting and get them into really, truly a medical home where they can get, as Ms. Harvey mentioned, client-centered care. When the patient is actually the center and involved in making the care decisions, because and that's kind of where the role of the community-based organizations come in, because we're kind of the boots on the ground, right? And we're kind of a trusted source of information. And if a clinical trial comes out, a lot of times the family will call us and say, well, what do you think about that clinical trial? So community-based organizations are such an important part of the whole sickle cell community, and we need to have more of them, aligned with all of the medical centers that we have, so that we can really educate families. I think that there are a lot of ways to describe warriors. They're brave, they're strong, they're resilient. But another thing is that they tend to be skeptical, right? And I think they have good reason, because they have been mistreated for so long. And things like the Tuskegee experiments, and I hear my patients talking about being guinea pigs and that kind of thing. So I think that we really need to help them to make informed decisions about being on medications, So I just think that patient education and patient empowerment are really key factors that we have to really address.
All right.
And Ken, I just want to add one thing to what Dr. Whitten has said, and Ms. Harvey has said, as Lena said. One of the things that's really important is what we said, respectful, compassionate care. And that's through shared decision-making. It is not a one-way journey. So when an individual living with sickle cell disease goes in and somebody says, well, you haven't had pain in the last year, so you don't need anything. That's not the right answer. Individuals with sickle cell disease, we know what it looks like when you're not on a medication to modify your sickle cell disease. So individuals who walk into a healthcare professional's office and walk out without any knowledge about what's out there for them and participating in the decisions about what they need to make themselves better, that is not high quality care. So we have to, just as Dr. Whitten said, get more centers that not only are aware of these medications, but understand the importance of having open conversations with all individuals living with sickle cell disease about what these options are for them.
I want you to hold on to that, because I'm going to come back with another question in regards to that a little bit later. I want to jump back into our Q&A. Megan writes in here, what additional data points should be included in future studies that collect information needed to assist with the access to better care? I see everyone thinking there.
I can start.
Yes,
we already know. We already know. If I really think that there should be a resource that allows individuals to understand where they can go for high quality care and where they can get what I used to call sickle cell friendly care, so that it's respectful and compassionate, that they know when they walk into an emergent setting for acute pain management, that they know that that hospital has a record of providing something to relieve their pain within 20 minutes of them walking through the door, within 60 minutes from them walking through the door. So finding places that can provide sickle cell specific care, and then notifying and having access to resources so that individuals living with sickle cell disease know how to get to that care. That is critical.
Someone asked earlier about the 100,000 number, that data point, if that's still consistent, if that's still true. Is that the case? Talk to me about that.
So that's a sad statement that we don't know the exact number. One of the issues is every baby born in the United States today in a hospital or that has access to care gets screening for sickle cell, right? Those results are not stored in a way that families understand what the importance of sickle cell trait is, C trait, and other hemoglobinopathy traits. Furthermore, individuals, once they get into sickle cell specific care, there is no monitoring by number of what happens to them over the lifespan. So the fact that we don't know the exact number living with sickle cell in the US today is a statement about the disparities that intersect with sickle cell disease, social, racial, and healthcare.
So we've got one more question I want to get to quickly. We're moving towards wrapping up with a couple of minutes here. Lynette asked, what is the best way we can support a person experiencing a crisis? And that is a time when, as you know, people are most in need. We spoke briefly about that. Anybody want to chime in here real quickly before we get to our closing thoughts?
Sure, I'll chime in there really quickly. So a sickle cell person, someone that has sickle cell, if they are in crisis at that moment, listen to what they tell you to do and do it. I just want to start there. But honestly, the amount of pain is unimaginable, which means that they're in suffering, which means that they're simply trying to find an end to the suffering at that moment. Crisis means a lot of different things to a lot of people. If we're talking, one that may be prolonged, that does occur, that's a different, type of situation. But if we're talking about one where it's like, time to go, please listen to them or their caregiver. If they say, I need to go to the emergency room now, say, okay, which one? Because my friends would have to ask me which one, and I would tell them which one,
Yes.
Don't take me here, take me there. And yes, sometimes it would be farther away, but please ask them if they have any travel letter, if they have a card that has their care instructions on it, if they wear a bracelet, just get them the help, get them to the help that they need, or get the help to them that they need quickly.
Right. So let's do this because we have time for one final question, and then we're going to get quickly into our closing thoughts. So question number 3 in our poll question for you today, that is, did you learn something new from this webinar about sickle cell disease and related inequities? Something new. If you learned something new, please chime in here real quickly. I want to go through my panelists, and if you can, each take quickly 30 seconds to give closing thoughts. We got through as much as we can. Your closing thoughts. What do you want to leave people with? Beginning first of all with Dr. Wanda Whitney, please.
Okay, thanks, Ken. I just, number one, want to say how much I appreciate being a part of this panel, but I do want to call attention to the National Academy of Sciences report, the NASM report, that gave a strategic plan for how to address these issues in sickle cell disease. And Dr. Kim Smith-Whitley was a major part of that. But we have a plan. It's just a matter of putting it into effect. And once again, I feel like the stars are aligning. We've come a long way, but we still have a long way to go. And we're in it till the end.
All right. If we can, please, Dr. Kim Smith-Whitley, excuse me, if you can please add your closing thoughts.
Well, thank you, first of all, for drawing attention to sickle cell and to those experiencing sickle cell and the sickle cell community. It's a great community that has been overlooked and neglected for far too long. Whatever we can do to draw awareness to sickle cell disease, World Sickle Cell Disease Day is coming up Juneteenth. And we also have Sickle Cell Awareness Month, but every day should be Sickle Cell Awareness Day. That's what this community needs. Finding ways to find good, high quality healthcare, making sure that individuals with sickle cell disease know what's out there to make their sickle cell condition better, and to make sure that they have access to high quality care. I think that includes respectful, compassionate care.
And finally, our warrior, Lena Harvey, if you can, your closing thoughts briefly.
Well, I just wanted to say, for anyone, I know people are wondering, my name is Lena Harvey. My Instagram is Lena Lavish 100. All right. just Lena Lavish 100. Find me there. Yes. I am on YouTube at Lena Lavish, the Queen Warrior herself. That's my channel. That's where you will see me putting up news and talking about sickle cell and, you know, sharing my journey. Please find me, you all. Everyone, please find me, because I'm here and I am blessed to be able to speak for warriors here, there, and everywhere. Thank you all so much.
So I want to say thank you to our panel. Thank you to our warriors who have joined. Thank you to all of the participants. I hope we learned something today. And as we learn in journalism, learning does not cease. I see our poll answer up here quickly. Most folks said they learned a lot. Some said some a little. No opinion. I'm of the opinion when we broadcast, if we change one mind or enlighten one individual, job well done. Thank you, GBT, for this opportunity. And we look forward to the opportunity to learn more about sickle cell and to inform. Thank you.